Hi, I'm Katie, and today I'm going to be showing you how to use an inhaler or a meter dose inhaler. I'm going to be showing you two different techniques that are pretty common and are pretty easy to do. So the first thing you want to do with your inhaler is you shake it a few times just to mix up the medication, make sure there's no sedimentation of the medication, especially if you haven't used it in a while. Then you want to remove the cap if you have one. I don't actually have one because this is an old inhaler. And then you want to, after you remove the cap, you make sure there's no large objects in there and make sure it looks clean. After you've established that, then you can prime it once or twice into the air. This just makes sure there's no dust or particles in the inhaler that you don't want in your lungs. And by spraying it a few times, that'll make sure it's cleared out. And you want to make sure you're not spraying it at somebody. You want to make sure you're not spraying it at yourself. So one of the techniques I'm going to show you is the open mouth technique. So this is when you place the chamber about 2 to 3 centimeters in front of your lips, or a better way to say that is 2 finger widths in front of your lips. After a normal exhale, you just take a big deep breath in as slowly and as deeply as you can at the same time you press the medication. You hold your breath for a couple seconds, 2 to 3 seconds is pretty good and pretty easy to do. And then you could just have a normal exhale. So that is the open mouth technique, and then there is also the closed mouth technique, and this is where you place the device between your lips, and it's the same deal. You press the medication at the same time that you take a slow deep breath in, and after a normal exhale. Again, you hold your breath for a couple seconds, and then you slowly exhale or normally exhale. So the coordination between pressing the medication and taking the deep breath in is pretty difficult, especially if you're pretty new at it. So there is a device that is pretty often recommended for children or for uncoordinated adults. It is called a spacer or a valve holding chamber. It is a plastic tubing that usually attaches here at the mouthpiece, and then the other end goes in between your lips. And the tubing just kind of captures the medication so that when you press the button, it's not as key for you to inhale at the same exact time. It also reduces oral impactation so that you get fewer side effects this way, and you also get more deposition into your lungs. It also is good as far as wasting medication. It's pretty common whenever you're just squirting it into the air like this. You're probably not going to get the full dose. So with the spacer or the valve holding chamber, you're going to get your full doses worth because you can actually breathe a few times through the chamber without losing any of the medication and without having to use more than one puff. So between puffs, you want to wait about 60 seconds because usually you're going to have to do more than one puff in your prescription. So wait 60 seconds, and that is the MDI.